Hello students, myself Abhilash, biology lecturer, Vishwamanava Composite PU College, Chitradurga. Today we are going to discuss a new chapter of 2nd PU biology, that is reproductive health. Introduction. According to World Health Organization, reproductive health is defined as reproductive health is a means of total well-being in physical, emotional, behavior and social aspects of reproduction. Reproductive health problems and strategies. India was amongst the first countries in the world to initiate the program family planning that was started in the year 1951. Reproductive health in a society forms a crucial part of general health. Improved programs covering wider reproduction related areas are currently in operation under the popular name Reproductive and Child Health Care, that is RCH program. Health and education of young people and marriage and childbearing during more mature stages of life are important attributes to the reproductive health of a society. Measures taken by a government regarding reproductive health through the help of audio visuals and print media. Even family members, close relatives are involved in the awareness program. Sex education was introduced in schools to provide awareness, proper information about reproductive organs, adolescence, and related changes, safe and hygienic sexual practices, and also about sexually transmitted diseases such as AIDS and etc. Then we have amniocentesis. It's a technique used to find out chromosomal abnormalities in developing embryo by using amniotic fluid. It is also misused to check the fetal sex determination based on chromosomal pattern in the amniotic fluid surrounding the developing embryo. Population explosion and birth control. Improved quality of people, increased health facilities and better living condition had an explosive impact on explosion of population. Rapid decline in death rate, MMR, maternal mortality rate and IMR, along with increase in population of reproductive age is the main reason for population explosion. Steps to overcome from population explosion. Using various contraceptive methods, educating people about demerits of large family, increasing the marriageable age of female and male, providing incentive to parents having one or two children. Contraceptive methods. Contraceptive methods are used to prevent unwanted pregnancy and modifying the menstrual cycle. An ideal contraceptive should be user friendly, easily available, reversible, effective, and no side effects. No way the contraceptive does not interfere sexual desire and sexual contacts of couples. Contraceptive methods could be divided into following categories. It includes natural methods, barriers, IUDs, that is intrauterine devices, oral contraceptive methods, injectable implants and surgical methods. Natural methods works on the principle of avoiding chances of ovum and sperm meeting, which includes three categories or three various types. First one is periodic abstinence. The couple avoid clotus from the day 10 to 17 of menstrual cycle as chances of fertilization are very high during this period. It is called the fertile period. Second one is withdrawal or clotus interrupts. The male partner withdrawed penis from the vagina just before the ejaculation to avoid insemination. Next is lactational amenorrhea, absence of menstruation after parturition due to the intense milk feeding and no ovulation in this period. Here chances of fertilization is completely nil. In barrier methods, the ovum and sperms are prevented from physical meeting with help of barrier, which includes condoms used by male. Barrier, it is made up of rubber or latex sheet used to cover penis or vagina and cervix in case of females. It also prevents sexually transmitted diseases. Diaphragms or cervical caps and valves are the barrier made up of rubber that is inserted into female reproductive tract during coitus. Spermicidal creams, jellies and foams are usually used along with these barriers to increase contraceptive efficiency. Advantages of barrier methods: they are disposable and they can be self inserted. Next we have IUD, that is Intrauterine Devices. These are the devices inserted by doctors or trained nurse into the female uterus through vagina. IUDs may be non-medicated IUDs, example Hypersloop, copper releasing IUD, example CUT, CU7 and Multilode 375, and hormone releasing IUD which includes LNG20 and progesterone. IUD increase the phagocytosis of sperm in uterus, and copper reduces the motility of and fertility capacity of sperms. The hormone releasing IUDs make the uterus unsuitable for implantation and the cervix hostile to these sperms. Next we have oral pills. Oral pills are progesterone and progesterone estrogen combination used by females in the form of tablets. They inhibit ovulation and implantation as well as change in the quality of cervical mucus to prevent entry of sperms. Administration of progesterone or progesterone estrogen combination within 72 hours of coitus is found to be very effective as emergency contraceptive. Next, surgical methods. These methods we also call them as sterilization methods. Here we have two categories. One is vasectomy and tubectomy. Vasectomy is a surgical methods in male in which a small portion of vas deferens is removed or tied up through a small incision on the sternum to prevent the release of sperms. Whereas tubectomy is a surgical method in females in which small part of fallopian tube is removed surgically. Next, side effects of contraceptive methods. It is very important that the selection of contraceptive method should be taken under the consultation of doctors. They have ill effects like nausea, abdomen pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer. Then MTP, medical termination of pregnancy. Voluntary termination of pregnancy before full term, we call them as MTP, or induced abortion. It plays an important role in decreasing population by aborting unwanted pregnancy. In India, MTP is legalized in 1971 with some restriction to prevent its misuse, such as indiscriminate and illegal female feticides. MTP is used in two conditions mainly: to get rid of unwanted pregnancies due to unprotected sexual intercourse or failure of contraceptives used during coitus or rapes, when pregnancy continuation could be harmful or even fatal to mother or fetus. MTP is considered relatively safe during only first trimester or up to first 12 weeks of pregnancy. Second trimester MTP is much more riskier. Next, we have STDs, that is sexually transmitted diseases. Diseases are infections that are transmitted through sexual intercourse, or collectively called sexually transmitted diseases or venereal disease, or it may be called reproductive tract infections. Some common STDs are gonorrhea, syphilis, genital herpes, genital rods, trichomonasis, hepatitis B, and AIDS. Hepatitis B and AIDS are also transmitted by sharing of injection needles, surgical instruments with infected persons, transfusion of blood, or from infected mother to the fetus. Next, infections of sexually transmitted diseases can be prevented by avoiding sex with unknown partners or multiple partners, always use condoms during coitus, go to a qualified doctor in case of doubt for early detection, and get complete treatment if diagnosed. Then we have infertility. The couples which are unable to produce children or reproduce children in spite of unprotected sexual cohabitation is called infertile. The reasons for this could be many: physical, congenital diseases, drugs, immunological, or even psychological. Infertile couples can be assisted to have a children through certain special techniques commonly called assisted reproductive technologies, we simply call ART, which includes in vitro fertilization, that is IVF, followed by embryo transfer. In vitro fertilization, fertilization occurs outside the body followed by embryo transfer, which is commonly called test tube baby program. The ovum from wife or donor and sperms from husband or donor are collected and induced to fertilize in laboratory conditions. The zygote or early embryo at 8 blastomeres could be transferred into fallopian tube. We call them as Zift, zygote intrafallopian transfer, and embryo with more more than 8 blastomeres are entered into uterus to complete the further development. Next we have gift gamete intrafallopian transfer. Transfer of gametes collected from a donor into fallopian tube of another female who do not produce ovum. Next we have ICSI, intracytoplasmic sperm injection. It is a specialized procedure to form an embryo in laboratory in which sperms is directly injected to ovum. Next we have some neat questions. First one is the method of directly injecting a sperm into ovum in assisted reproductive technologies is called. The correct answer for this is ICSI, intracytoplasmic sperm injection. It is one of the techniques of assisted reproductive technologies that can help couples to overcome from their infertility. In ICSI, the sperm is directly injected into ovum in vitro to form zygote and leads to embryo, which is later implanted through Zift to woman. Next, increased IMR and decreased MMR in a population will option A cause rapid increase in growth rate, option B result in decline in growth rate, option C not cause significant change in growth rate, and option D result in explosive population. For this, the correct answer is option B, result in decline in growth rate. If there is an increase in infant mortality rate IMR and decreased in maternal mortality rate MMR, mothers are available to give birth to infants, but the infant survival rate is low, which will ultimately hinder the growth rate and their particular population. Intensity lacting mothers do not generally conceive due to option A suspension of gonadotropins, hypersecretion of gonadotropin, suspension of gametic transport, and suppression of fertilization. For this, the correct answer is option A suppression of gonadotropin. Presence of prolactin hormone in the blood of lacting mothers suppresses the release of gonadotropins, which includes FSH and LHS from the pituitary gland. Next, a national level approach to build reproductively healthy society was taken up in our country in the year. So that the correct answer is option A 1950. Next, emergency contraceptives are effective if used within option A 72 hours of coitus, 72 hours of ovulation, 72 hours of menstruation, and option D 72 hours of implantation. For this, the correct answer is option A, that is 72 hours of coitus. Next, choose the right one along with the statements below. IUDs are generally inserted by the user herself. IUDs increase phagocytosis reaction in uterus. IUDs suppress gametogenesis, and IUD once inserted need not to be replaced. For that, correct answer is option B. IUDs releases phagocytosis reaction in the uterus. That reduces the process of fertilization. Next, from the sexually transmitted diseases mentioned below, identify the one which does not specifically affect the sex organs. Option A syphilis, gonorrhea, genital rods, and AIDS. For this, the correct answer is option B, AIDS. Condoms are one of the most popular contraceptive because of the following reasons. There are effective barriers for insemination, correct only. They do not interfere with coitus act, this is correct. These help in reducing the risk of STDs, that is also correct. So the answer is option D, all of the above. Next, ninth one, choose the correct statement regarding the Zift process. So for this, the correct answer is option B. Zygote is collected from a female donor and transformed into fallopian tube. So the last question, the correct surgical procedure as a contraceptive used method is option C, vasectomy. Remaining are not used in surgical method, whereas vasectomy it is used in case of males. Thank you.